On March 6, Brandon Jansen smiled for the camera, but he was anything but okay. By day 3, without the medication that kept his cravings for fentanyl at bay, he was in withdrawal, says his mother, Michelle.
I saw him on March 6th, the day before he passed, and he says, "I'm struggling. I can't hold it." And I had a meeting with the medical team and said, "Look, you have to do something."
Brandon's cell phone shows by midnight he was waiting for a drug dealer. He should be any second, texted another patient.
The text messages show the chain of communication between Brandon and this other patient. Brandon confirmed once the drugs were dropped off to him at his room, and that was at 2:15 a.m. At 2:45, he dropped to the floor.
Brandon's last text said, "Just met him." The BC coroner is now investigating what went wrong in the 11th rehab center he had tried.
It's going to be a week-long inquest starting in January, and the findings of that will be used to implement changes and recommendations going forward. It's amazing because things will change.
I would honestly be very happy if they got shut down for what happened.
Brandon's little brother Nick, who also lost his girlfriend Guinevere Stadden to overdose last month in Coquitlam, says drugs should not be so easy to get in rehab.
He wanted help right away. He said, "This is taking me." He said, I'm no match for this drug. It's horrible and I need help." And we tried to get him help, and no treatment center was willing or able to give the help that he needed.
How much did you spend overall?
Over $200,000 in treatment costs. And I still lost my son, and lost him in a facility that touts themselves as one of the best.
As Canada's leader in men's treatment,
The doctor at the Sunshine Coast Health Centre did not yet have an exemption to prescribe Suboxone, the pill that had been working for 2 months to help Brandon stay clean. BC would not lift restrictions on who can prescribe Suboxone until July, 4 months too late for Brandon. Citing privacy laws, the Sunshine Coast Health Centre wouldn't even confirm if Brandon stayed there, but the owner did issue a statement saying, "We have only had one critical incident in the last 12 years. Sunshine Coast Health Centre is in full compliance with our provincial regulation at all times, and we take that requirement very seriously. Our evidence-based programming and 24-hour staffing meet the highest standards. Our centre is in no way reluctant to be participating in the BC Coroner's inquest designed to bring attention to the devastating effects of fentanyl on the lives of British Columbians. The family is relieved the coroner will hold a special inquest."
The coroner told me herself that when Brandon passed away, he didn't have that tolerance. So what he would have considered a normal dose was enough to kill him.
In fact, many of the people who are dying of fentanyl overdoses are just like Brandon. They've done detox, gone to rehab, and the first time they relapse, the fentanyl stops their heart. Doctors say every rehab center in the country should be sending addicts home with a prescription for Suboxone and a relapse prevention plan.
There's something about the opioid-addicted brain that your brain chemistry changes, and it's very difficult to stay abstinent and safe without being on long-term medication. Right now we know it's dangerous to admit them to a center where they're going to lose their tolerance, statistically back out in their environment, relapse, and that big risk of overdose and death.
He says the whole addiction system needs a major overhaul so the latest proven methods become the rule rather than the exception. While this center now routinely prescribes Suboxone, most don't, according to our research, even though it's supposed to be the first line of treatment for an addiction that is killing so many. Natalie Clancy, CBC News, Coquitlam.